the Vata, the types of Vata there are. I mean, you said Apana, Vayu or Apana Vata, Samana Vata, but I don't think our viewers know all of these. So it would be nice.
Yeah, sure.
I mean, some of them, sorry.
Some of them, yeah. So I think regarding the doshas, the concept of doshas, how to understand them in terms of modern knowledge, I think we'll take a separate podcast on this. But to brief, every dosha, that is Vata, Pitta, and Kapha, is subdivided into 5 types. And each of these 5 types have a specific function allotted to them. So Vata is again of 5 types, which is prana. Like I said, it deals with, just to concise the knowledge, it deals with respiration or breathing, prana, right, oxygen. And then there is udana, which resides in the throat, and it is responsible for voice of a person. And then there is apana, which is the vata that's located below the umbilicus, on the lower side of the body. Apana is responsible for expulsion or excretion of things like excretion of stools, excretion of urine, or excretion of menstrual blood, or helping a pregnant woman deliver. That is Apana's job, And Samana, which I think is one of the most important types of Vata. Samana is the Vata of the gut, right? And a lot of patients come with a Samana Vata imbalance. Like whenever there is gut imbalance, be it poor Agni or erratic Agni, weak absorption of nutrients, Samana Vata is responsible for it. And then there is lastly Vyana Vata. Vyana Vata is the Vata responsible for circulation of blood or lymphatic fluid or anything that is circulating throughout the body. Vyana circulates throughout the body. So yeah, this is the 5 types of Vata. We'll deal more in the coming podcast.
Yeah, that's all. The brief is good.
Yeah.
And of course, the directions also you went into it, because that's something that is very important, I guess.
Yeah.
Like you talked about the Vyana being circulatory and stuff like that. So, I mean, I just wanted that to make our viewers understand that there is each thing has so much depth in there, and there is there's a lot of science in there as well, right? Like how some Vata, which is mostly under the control of the element air, and how there is directionality to it, right? Like you said, the Apana goes outward and things like that. The Vyana is circulatory. So all our body, which is full of movement, has so many directions, and each of that was in detail discussed in Ayurveda. So I just wanted a little bit of a glimpse, a view of what was the thought process when you were talking about all these various vatas. So I just, and that was very nicely done. Thank you, Dr. Aditi. So I mean, everything you said is very interesting. I was like, absolutely, I think I always learn a lot more. That brings me to about the metabolism, right? So I understand that Ayurvedic herbs also undergo, of course, any herb will undergo metabolism, right? Same with Ayurveda. And it probably happens in the liver and other tissues, and then they get transformed into active or inactive metabolites, right? And then the metabolism of these herbs can affect their bioavailability, how long they're active, I mean, the duration of their action, and then any potential side effects, right? So certain herbs can also interact with enzymes which are involved in the drug metabolism pathway, and leading to probably alterations in the metabolism of other substances and stuff. So just curious to understand Ayurvedic concept of metabolism and also the metabolism of the herbs.
Yeah. So this is a huge concept, and I think personally, metabolism or Agni in Ayurveda, Agni, like I said, it refers to the digestive power or the metabolic energy that is responsible for transforming food, substances, herbs into energy and body tissues, right? So for us, metabolism can be equated to what Agni is doing within the body. So it is the cornerstone of health and vitality. right? Agni is the reason why we correlate it to metabolism, Dr. Usha, is because Agni, in the list of Agni functions, it governs digestion, it governs absorption, it helps with assimilation and overall metabolism within the body. This is what the list of actions that are told when a person is having healthy Agni, right? So when this Agni is balanced and strong, it can promote optimal health, it can lead to vitality, longevity, a disease-free survival, right? When Agni is weakened or imbalanced, as it is that we are seeing so many cases right now of the same, it can lead to various health issues. The primary ones being digestive disorders and lethargy, when people say that I don't have energy or I'm fatigued all the time, and toxin accumulation. I think personally these three are the topmost complaints that patients give when their Agni is weak or imbalanced. And that is why the relationship between Agni and metabolism is profound. So this Agni, it governs metabolic processes. It governs the breakdown of food into nutrients, the conversion of nutrients into energy, and elimination of waste products. All of these things are handled by a robust and balanced Agni. If we go deep into this concept of Agni, there are three types of it. I will just give a brief to understand and not confuse people about so many factors and names.
Yeah.
Jataragni. So Jataragni, this is the main digestive fire that's located in the stomach and small intestine. It breaks down food into small particles and helps with nutrient or herb absorption. Then there is Bhutagni, which is the elemental digestive fire, and that's present in every cell. That's responsible for cellular metabolism, energy production like ATP. Then there is Dhatvagni, very, very crucial. Dhatvagni is the metabolic fires present in each tissue or dhatu of the body. And this Dhatvagni is responsible for transforming the nutrients that come from the diet and from the herbs to tissue specific components or active metabolites. So whether a person is having food or a person is having the medicine, it goes inside, and Jataragni, Bhutagni, and Dhatu Agni are responsible for the conversion of that diet and the herb into active metabolites, and then absorption and going to different tissues and giving the therapeutic action. So that is why I always say that when a patient comes to us with a weak Agni or impaired digestion and absorption processes are compromised, this can lead to incomplete digestion of the herb. It can lead to reduced absorption of their active components, and it can lead to inadequate assimilation of this metabolites into the body. So that is why the therapeutic effects of the herbs or the formulations may be diminished and their potential benefits may not be fully realized. And that is why in all initial line of treatments that I just discussed, Ayurveda points out towards enhancing the strength of the Agni before the main line of treatment begins. So this leads to better efficacy, better absorption, and enhanced action against the disease pathology.
Yeah, no, that's very, very detailed. Though you said a few words, you said you'll say a few words, but it was just the right amount of words to discuss the importance of Agni, right? The metabolic fire. I mean, we say metabolic fire as one word, but in Ayurveda, like you've nicely described the three different forms and why it is important, and how there is the tissue Agni, then the cellular Agni, and then of course the digestive Agni, and how each of them interplay, and how it's a fundamental concept in Ayurveda, where we are talking about digestive fire, metabolic energy, transformation of the food that is assimilated, like you very in detail you described all that, and then also of transformation of the thoughts, of the experiences, all of that into energy, right? Ayurveda goes into beyond all that. Beyond not only in food, but beyond food, thoughts, experiences, and consciousness, all that transformation of in processes. And I feel it's so crucial for overall health and vitality, like you discussed, how people come. Nowadays, we always see, I agree there that I always see people with low Agni, most of the times,
Yeah.
right? Or as we call the mandagani, and it's pretty
Correct.
common.
Yeah.
And how it plays such a big role in digestion, metabolism, and general well-being for number of for everybody actually. And I think you already discussed about how you using these processes, the Ayurvedic herbs are eliminated from the body using various routes. I think like the renal excretion, you already, I think, kind of alluded, the biliary like the liver and all that stuff. And I feel the elimination half-life of these herbs probably do vary depending on factors such
Yeah.
as their molecular weight, the lipophilicity, and the renal function. And I think that's where you kind of talked about the anupana or the vehicle, right? So it helps in also the right uh, uh, vehicle along with their molecular weight and all that also probably do play a role. And
Yeah.
then maybe because of that, some herbs probably get out quickly, and others may accumulate in the body for a longer time.
Correct.
So
Correct.
right. So I would like to know more from you about excretion in the way Ayurveda explains excretion.
Excretion.
If you want to watch the answer, stay tuned for part 3.